balance, as well as metabolic health. And today on Lunchtime Live with the Center, Dr. Reeva Makhijani is back to discuss PCOS, what it is, how we treat it for women who are trying to conceive, and dispel some myths around it as well. Dr. Makhijani, welcome back.
Thanks for having me back.
So what exactly is PCOS? Where does it come from also?
PCOS is a very common disorder among women of reproductive age. It affects roughly 1 out of 10 of women of reproductive age. It is basically a disorder where there is some hormonal balances of the reproductive organs, as well as some issues with metabolism, metabolic disorders. And often, women will present most commonly to me because they're having trouble getting pregnant. And their most common symptom of the disorder is having irregular periods. They'll often tell me that they don't get a period every month. And that's usually the most common complaint. Where does it come from? It's multifactorial. There's no specific cause. There may be a genetic component. You may be more likely to have it if you have a strong family history for it. But it can happen anytime once a patient gets her period.
Okay. So you can see it as young as if a patient got their period at 12, 13, you can see it then too?
Yep. A lot of women will say that, their periods have always been irregular since they started having it. Others find that their periods became more irregular later on in life. So it's variable, but it can certainly occur in adolescent patients.
So aside from having irregular periods, how do you diagnose it? Because I imagine there are other patients who don't have PCOS that have irregular periods.
So it is a diagnosis of exclusion. So basically that means we have to rule out other disorders that can also cause irregular periods to confirm that a patient indeed has PCOS. We use a criteria. One of them is having irregular periods. So either a patient's periods come at very long intervals, or they don't get a period at all. The second is that they have signs of high androgen production. So those are the male hormones. So they might say they have acne on their face or hair thinning, or they might describe having more hair growth on their face, chest, or abdomen. If they don't have any of those things, we also check blood work to look at laboratory levels of those androgens to see if they're elevated. And then we also do an ultrasound to see if the ovaries have what we call a polycystic appearance, where there are lots of little eggs or follicles that we can see on ultrasound imaging. And then finally, we check other labs to make sure that it isn't something else, like a thyroid level, other hormone called prolactin, and then there's a couple of other conditions that can look similar to PCOS, so we check those as well.
So how often does someone come to you already diagnosed versus them realizing this at the center?
I think it's kind of 50-50. Some women have known all of their lives since they were teenagers that they have PCOS and had irregular periods, and for that their gynecologists have put them on birth control often to help regulate their cycles. Some have no idea, and they're trying to get pregnant now and having difficulty, and so that's how it comes to attention. So I think you can go both. I've seen it go both ways pretty equally.
Is there a benefit to getting diagnosed earlier on in life than when they're trying to get pregnant or when they come to us?
So PCOS does have, implications for patients' overall health aside from just fertility-related concerns. As I kind of mentioned earlier, women with PCOS often have metabolic disorders. It's more likely that they can go on to develop diabetes. They often have trouble with weight loss. they can be at higher risk for obesity, for heart disease. So, knowing kind of early on that you may be at higher risk for those conditions may make you, make some lifestyle modifications sooner rather than later to help kind of prevent the onset of those things. The other thing is, because they get irregular periods, they can build up the lining of their uterus, and that can predispose them to endometrial cancer.
Mm.
So it is important to get a period each month. And so even when they're not ready to get pregnant, it's important to control their cycles to prevent something like that from happening down the line.
Now, are there different types of PCOS? Does it always present with metabolic health concerns?
There are different patients with PCOS can present very differently. Some of them are very, very lean and don't have a lot of the common clinical signs like the hair growth or acne, but they still are having irregular periods. Whereas, some patients have more of the metabolic syndrome aspect of it, where they're obese and they have trouble with weight loss. And so, yeah, there are definitely many patients can have PCOS, but they can look very different from each other.
And is PCOS in itself, is it painful?
No, it's not painful. I would not say that pain is a part of the condition. It's more, it's usually irregular periods or irregular bleeding.
Okay. And so if someone has PCOS, even if they're younger and they're diagnosed, does it automatically mean there will be challenges to conceiving, or will they need IVF? Is that something that's a kind of a given?
Good question. No. So, what happens with PCOS is that these women don't get a regular period. So they may not ovulate each month, but that doesn't necessarily mean that they never ovulate. So if they have intercourse during a time that they are ovulating, then certainly they can conceive on their own. The challenge becomes that, they may not ovulate for long stretches of time, and they may not necessarily know when they're ovulating without some additional tracking. So that can make it harder for them to get pregnant, but absolutely they don't necessarily need fertility treatment. They often don't need IVF, although that is something that some of them end up needing, but they can definitely get pregnant on their own.
Okay. And what are some medical treatments or protocols? What do we do in our office for women who want to get pregnant, but they have PCOS?
Yeah, so, we start by taking the history, we'll do the evaluation, confirm that's really what's going on, and then often the most simplest, treatment, because of the ovulation issue, is that we can prescribe pretty easy, cheap medications that can help these patients ovulate more regularly, and then they can time intercourse at home. And then, if they don't get pregnant after several cycles, we can kind of escalate from there by adding things like IUIs, inseminations, and then, if we need to, we can get more aggressive and do IVF.
Okay. And is this something that can be managed through diet and lifestyle? What else can patients be doing at home?
Yeah. So lifestyle modifications is the first line. So the data shows that if these women even lose a modest amount of weight, 5 to 7%, they may start spontaneously ovulating. So that would benefit them in terms of their overall health, but also make it easier for them to try to get pregnant on their own at home.
Okay. And for women who are going through IVF with PCOS, does it affect, how exactly would it or would it not affect getting a frozen embryo transfer?
Yeah, so women with PCOS tend to do really well with IVF. They tend to have a higher egg count, than average. And so, the process for IVF, for everyone out there, involves taking medications to stimulate the ovaries to produce lots of eggs. And so since these patients tend to have a higher number, which end up getting a lot of eggs from them, fertilizing them with sperm, and often they make lots of embryos. So, their prognosis is very favorable with IVF.
Okay, great. And would a patient, once they do get pregnant, they have PCOS, they do get pregnant, but they need to do something different once they're pregnant to manage their PCOS? How would that show up for them?
In pregnancy, women with PCOS are at higher risk for certain obstetric complications like gestational diabetes, preeclampsia, so elevated blood pressure during pregnancy. So they need some closer monitoring for that. But otherwise, their OBGYNs would follow them.
Okay, excellent. There's a question. How would you differentiate between a PCO ovary versus a young ovary with an ultrasound if this is something that's diagnosed with exclusion and a patient is in her young teens?
It's a good question. Yeah. So with the diagnostic criteria, you exclude all the other options, and you need 2 out of the 3 other diagnostic criteria to make the diagnosis. So if the patient is having regular periods, but the ovaries look polycystic on ultrasound, they don't get the diagnosis. But Cassie is right that it can be challenging in a younger patient, especially one in early adolescence who may have just gotten her period, because periods are often a little bit more irregular when you first start getting them, and you would expect a young person to have a lot of eggs in her ovaries. So you have to really consider the other aspects of it as well, but ultimately for like an adolescent, if they're having irregular periods, then you can still go ahead and treat them to help with cycle regulation. We don't need to treat PCOS solely based on the appearance of the ovaries on ultrasound.
Awesome. Now, looking at a couple of myths, one of them is you did something to cause it. Is that the case?
No. The simple answer is no. I mean, again, we don't exactly know what causes it, but it seems to be something genetic, but multifactorial. But no, there's nothing you did to cause it.
What about if you lose weight, you can get rid of it?
Weight loss can definitely help manage the symptoms. And like I said, it may help you spontaneously ovulate. It can help with the metabolic aspects of the condition to make you less likely to develop diabetes later on. So it can reverse the adverse consequences of having the syndrome.
Okay. PCOS is a rare condition.
No, very common. 10% of women of reproductive age have it.
Okay. You can't get pregnant if you have PCOS. You had just talked about that.
Yeah, you can definitely get pregnant. You may be able to get pregnant on your own, and we can certainly help you if you're having trouble.
Okay. And finally, does PCOS only affect overweight women? And that would be a myth.
No, I mentioned this, but there is like a lean phenotype or a lean variant of PCOS. So it can affect women of all different BMIs and weight groups.
Excellent. All right. Well, thank you, Dr. Makhijani, for being here. I appreciate it. And I'm sure all of the people who are watching this are going to appreciate all of this great information.
Yep. Thanks for having me anytime.
Sure. And we will see you next time on Lunchtime Live with the Center. And if you have any questions, comments, concerns, or if you just want to learn more, please check us out at our website at uconfertility.com. Bye for now.